Dr. Peter Zafirides. So excited you are here today. Thanks for coming on the Dare to Dream podcast.
Oh, this is awesome. I've been looking forward to this for a long time, Greg.
I am so excited that all three of us get to be here. Vinny's here as well. Vinny, you want to say
Yeah.
hello?
Hello. Yes, we got three different time zones across the world. This is a big one.
The magic of the internet. Yes.
Yep.
It is going to be a powerful episode. And Vinny and I have so many questions we want to ask you, but I think where I wanted to start today is asking what exactly does a psychiatrist do? Because that's a term people have heard of. There's psychologist, clinical psychologist. You have an MD after your name. You got a
Yeah.
lot of cool stuff going on. So please tell us a little bit about what you do.
Yeah. As a psychiatrist, you typically go through medical school after college. So we do 4 years of medical school. And just like any other specialty in medicine, whether it's surgery or internal medicine, psychiatry is one of the specialties. So psychiatry then involves a year of internal medicine and then 3 years of psychiatry. And that's essentially the process. So with that, getting our MDs, we do have the ability to prescribe, but then just depending on the program that you're in residency and what the focus is, you should get some psychotherapy training as well as the biological training. So it shifts over the years, obviously, with younger psychiatrists coming out and more focus on the biology. It makes sense that some programs are geared that way.
I love it. We are going to span many different topics for today
All right.
across chronic pain, depression, anxiety. I have some questions about guilt, but where I wanted to go next is we've been trying to set this up for a little bit, and you sent me a picture of you on LinkedIn with the caption
Oh,
that said,
yes.
3.5 years ago, I was hospitalized for a crippling depression. Shortly after
That's
that,
right.
I had to have knee surgery for a torn meniscus. Fast
Yeah,
forward to this today, which was Sunday, October 22nd, you sent me a picture that you had completed a marathon.
that's right. Yes, it was kind of a culmination. Just trying to think, how that all happened over the years. Where, going back to 2021 in the spring, after a bout of COVID, and where my doctor had said, "Look, you have a history of depression. Some of the data that's coming out, with COVID in those that are depressed, it's showing that there might be a 1 in 3 chance that you could have some type of exacerbation of your depression." I didn't have that bad of an infection, so I thought, okay. I was more concerned, how do I get back to running? Was the biggest thing for me. So, but it just I started to feel it in the months afterwards, right in the early part of spring, March, April. Something was starting to shift, and for me, it's a different type of depression. In some ways I'm very fortunate, in other ways I'm not. But mine isn't the type of depression where I suffer with it for a long period of time, of years, of years. Typically, what happens is it's come on in my life, and it seems like it's going about these 20-year spans, but when it hits, it is absolutely crippling. I remember when this happened back in 2000, 2001. Didn't need to be hospitalized at that point, but I did have to step away from my practice for about a month to recover. And At that point, I just, wasn't married at that time. I had family that was around me to help guide me through that, and great treaters as well. But it's just started to get bad, and by May, I just realized that I just couldn't go on like that. My partner I remember when she came in during one of the days when I walked in the morning, and she's like, you can't. You can't do this anymore." And with that, my wife came and got me, and we had gone down to the local emergency room, and it was determined I had to go, inpatient. And then began a process of a few weeks of getting treatment, being discharged, and then going through the process of therapy and getting back to full form. So it really hit me out of nowhere. And At the same time, I'm struggling with a knee issue, and on top of that, long COVID, and I think this is what kind of had hit me the worst. I completely lost my sense of smell and taste. And as it came back, it was distorted. So it wasn't so much the beginning, because I thought, okay, I'm aware this can happen. It's going to come back. But as it came back, it was this real terrible kind of chemical, almost sulfury smell that I would smell. and also taste in foods. And I think that that just not getting better in that initial part and having to reconcile it, along with maybe what was happening biologically with me as it related to my mood, just cratered me. And it took the better part of a year for all of that to come back. I mean, it started coming back, but it was about a year. And even to this day, there are a few cents. I mean, I'm almost probably 99.5% back. But so there was all those things kind of coalescing at the same time, and I was down. I was just down.
That sounds so hard to handle. And especially as someone who I imagine has treated so many people for their depression throughout the years,
That's right.
what is it like being the teacher who now has the affliction?
Well, it's, I guess I had had it before, so I kind of had a sense of it. But for me, when everyone says, "Well, how can you be a psychiatrist? All you do all day is hear problems." And I guess for me, you know, I see it differently. What I see is the strength of human beings being able to come in and, despite everything they struggle with, they dare to carve out a life, a job, relationships, being parents, whatever it may be, despite all of this, right? And I just remember just being knocked down so much and trying to remember that for myself, but just there was nothing there. There was just this vast kind of emptiness and nothingness. And I remember thinking to myself, like, wow, all the strength that I see in these other people, and I can't get it together, And I remember when I was in the hospital walking around this little kind of U-shaped ward, and that's what I was thinking, like, I cannot lift myself out of this. I hear and I talk about all this strength, but there's none there for me, at least at that moment in time. And when you're in it, it doesn't feel like it's ever going to get better. It
Mm.
just, you know that it will on some level, because I can tell myself intellectually there's no way. I mean, it's not like this is going to be my life forever, but it just feels impossible. I don't know how else to describe it.
What is depression? Like we hear the term all the time, and I think it is something that afflicts so many people. But what is it, and what do you think like caused it with you, and how do well, I'll start there. What do you
Yeah.
think is the initial cause of it for you?
Yeah, I think, well, depression in general, I mean, it gets thrown around a lot, and I think that's okay. I mean, depression and sadness is a part of the human experience, right? So people can get depressed and it's not clinical. People can get very happy and it's not mania, right? So, I think that's fair to be thrown around like that. When we talk about clinical depression, though, it is that pattern of sadness where there can be a severe loss of interest, energy, concentration, sleep may be disordered, appetite may be disordered, there may be suicidal thought, but it gets so impaired that you're not able to meet, let's say, your interpersonal responsibilities or your social responsibilities, your work responsibilities. All of that goes away. So when it goes from, if I'm feeling bad to some degree, to I can't get off the couch, I can't go to work, I can't take care of my kids, I can't wash my body. That's where we see that happening. For me, I think it was just there's some family history of depression in my family, so I'm not the first one to be afflicted within our family. And in particular, my uncle really had some, malignant depression. He's passed away since, but he had some very, very difficult to treat depression. So I think there's some loading of genetic history for me, and I think there is this pattern for me that occurs, every whatever it is, 20 some years when it hits. But I think for me, it's when there is this kind of coalescence of things. I remember back then, it was my back injury and coming through real severe chronic pain that had set it off, just the desperation that came from that. And then that took me down. So I think here it's fair to say, I don't know if it was necessarily the COVID virus itself or how I just couldn't deal with some of the post-COVID struggles that I had with my smell and my taste, and it just overwhelmed me. So I think
Hmm.
that's, kind of where it was, because from, on paper, happy marriage, loving kids, supportive family, great friends, great practice, love what I do. There's no reason, on the surface for me to be getting depressed in any way. There weren't any situational stressors other than the physical that I was facing to explain why I might be feeling the way I was.
And I have to
Hmm.
imagine that that probably almost makes it harder when on paper everything's great and there's not some blaring reason why you should be depressed, and yet you still are.
Very true. But, also I can then just really relate because that's what I see in those that I treat, right? I mean, people have successful families and supportive marriages, partners, children, meaningful things in their lives. Yet that is kind of the desperation in it as well. They come in and they can't reconcile. How can I feel this bad when there's not that much bad going on? But I feel like it's
Mhm.
all coming apart, right? It's kind of the irony of depression, and it can be just terrifying.
Mhm. Something I've been thinking about is this book that I love, The School of Life by Alain de Botton. And he talks about In Praise of Melancholy. And I've been thinking about it lately and just through my chronic pain history that on the surface, like my life just seems awesome. Like I'm in Tokyo, I'm traveling, doing what I love, but underneath, I've dealt with this crippling back pain and
Yes.
just this mysterious thing for my entire 20s. And where I've been thinking about that book and just this thing, melancholy, and I think it's depression is much deeper, and that's a whole just another layer of it. But it's this thing of not needing to like because I think kind of in our modern day, a lot of people feel that way. Of my life is on paper, things are going great. I shouldn't feel this way, yet underneath something is missing. Something's making me feel this way, and he talks about in this book of instead of trying to push that away or act as if things should be good all the time or I should be happier, to really just settle into this thing that we all feel called melancholy. That even though if it's a beautiful day, it is okay to feel just down or to have a bad day, and to really kind of praise that and connect through that and realize that it's part of the human experience to just have this kind of underlying um, melancholy, like this
Yeah,
kind of a
yeah.
sadness, because that's what life is. And what did you learn just through your depression and through, we do like to get deep here on the Dare to Dream podcast. So dive in. Like what have you learned? What lessons have you taken from the
Sure.
difficulties in your life? Yeah.
Yeah. No, it's a great point. I'll address the first in terms of just, being able to sit within the melancholy. Let's say it's not this severe depression. For
Hmm.
me, I think a lot of what we see, and I don't know how we ever prove this, but it's my belief that a lot of what we feel mood-wise really does come from probably evolutionary remnants of behaviors that were adaptive in the past, right? And we have some evidence of that in the biological as we look at depression, right? When we get depressed, think of the feelings that we have, we tend to pull away and withdraw from individuals or, just life in general, right? We know that inflammatory markers and various types of blood cells that fight infection rise, right? And that might be part of the reason why untreated over time depression biologically chips away through this inflammatory process. Many decades down the line can lead to increased risks of cardiovascular disease or dementia or cancer or what have you, autoimmune diseases. So if we could understand it that way, we could understand maybe man in the past when they got sick or ill, got depressed, and there was an advantage to that because if you pull away, and pull away from others, first, you're not going to infect the tribe. But if you pull away and don't feel like doing anything, you're conserving a lot of energy to allow the body to heal. And that may be part of what we understand with seasonal disorder, right? It could have been that if we had the ability to look at our ancestral lineage, I wouldn't be surprised at all. Those that suffer with seasonal affective disorder, their ancestors might have come from extreme northern or southern latitudes where there's an advantage to being more depressed, not wanting to leave the cave in the winter. You
Mm.
support your calories because you don't burn them and you don't get bored. You don't feel like going out where it can be very dangerous for you. So these things serve to pass on our DNA. Person may not live a long enough life because they're not as happy, but it's enough to be adaptive. And those people that had those genetic traits pass them down. So today it's not all or none, but or life or death, but these things can still trigger these feelings. So, I think insofar as it doesn't get clinical, I do believe that there's a lot of worth in allowing yourself to sit in it for the sake of realizing you can be there and that it is transient and you move out of it, right? So, in the sense that you don't fear it when it comes because you've been there. And is there something you can take from that? I mean, so many artists and musicians and writers have been afflicted with this because there's something about mood states in the extreme that can be very expressive, right? So we see some benefits from that, but there can be a lot of introspection, that comes from that. Um, as it relates to me personally, I really believe that there was some fundamental change for me for the positive after having come through this. And in reading about things, the one principle that struck me, and I think applies to me, is post-traumatic growth. So, having gone through something very terrible or a tragedy does not mean you're always going to be traumatized where it will be negatively affecting you. Some individuals can take from that and find profound meaning in it, can find a greater existential or spiritual connection with life or with others, or find a new perspective about the meaning of it all that is very encouraging and very strong. So, to me, it just felt like something shifted. Now, who knows? I probably will get depressed again at some point in my life, but in being able to go through this, and this is also one of the, if you look at some of the literature on evolutionary depression, one of the benefits is thought to be from evolution, having gone through it, that you survived it and came through. Even in the early literature, hinting at post-traumatic growth, even before that concept really took hold in the late 90s and early 2000s. So I do think that depending on the individual, obviously, I think it also depends on the support that they have. But I don't think that everyone who goes through this is destined to be traumatized from it. And I think my patients are shining examples of that because they dare to continue, their lives, uh, both when they're down, but also when they're up. And I know how they really take that in and savor the fact that they're feeling well, and do good things with their families and themselves.
I'm curious about the 20 years because you said 20 years ago, 20 years before that. What is there any significance to that, or does that just seem like a naturally occurring time?
I don't know. I mean, those are the two times that have been really bad for me. I can't say I've had occasional periods of depression, but nothing that was clinical per se. So I don't know. I don't know if there is a vulnerability, and then if there is an event. I mean, I remember one of my attendings in residence said all depression is situational, right? So there is something that will kind of spark that to occur, whether it is something personal that you've gone through, a biological insult, something, and then it sets the stage. So I don't know if for me, there's some vulnerability at that period of time with the wrong circumstances. Maybe if that was 10 years prior and something bad had happened, perhaps it would have happened then as well. So I don't know. But I've not been able to link any, significance to 20 years.
Hmm.
Interesting. And I
Yeah.
know I know we're going to talk a lot about chronic pain, and I'll let Vinny lead that discussion because he's our resident expert at the moment. But
Thank
before
you.
we shift gears into that, I did want to ask about two emotions that we talked about briefly on LinkedIn, which was guilt and
Yes.
anger. Maybe we start with guilt. How does one handle or make use of guilt or make sense of it? It's a very
Yeah.
complex emotion.
It is an extremely complex emotion. And there are so many ways to look at this, right? And sometimes you need the guide of, a therapist or a counselor or a coach, to help you through this, and not necessarily because they have profound expertise at teasing something out. And I really reject that, especially with my stance in existential therapy. I really have always throughout my career almost resented the fact that I'm the professional and you are the sufferer. That, I think much of the transformation that occurs in therapy, and I've experienced it myself in my therapy sessions, when I was in therapy. were not because of profound insights that came from the therapist, but that we were in a shared journey and there were some things that were able to be discussed. So I think as it relates to guilt, being able to take the time to understand, where is this coming from? What on the surface am I feeling that is leading me to be guilty? And then how can I honestly try and understand and take note of perhaps some of my vulnerabilities, some of my insecurities that are leading to this, right? What were the processes that came into play that led me to feel guilty about this or that? Did I handle a certain circumstance wrong? Or was there something that happened earlier in my life that wasn't necessarily even my fault, but made me feel bad that I now conceptualize that as guilt that I take responsibility for? And then how can we take that outside of ourselves, look inwards, and then try to heal from it? So it can be a complex process, but people can work through guilt.
That's a super helpful answer. And I'm really resonating with what you're saying around not having that separation of power between the coach, therapist, psychiatrist, and the patient, because some of the best breakthroughs that have happened in coaching sessions, I'll ask a question meaning it to mean one thing and they'll interpret it wrong and answer a different
Yes,
question, and that gives them an insight. And that's the biggest, like, yeah, you're not doing the work here. You guys are together sharing the work, and beautiful
yes.
things emerge from it.
Yeah, it's you bring up an interesting point. It made me think of something. There's a great book by other than Dr. Sarno, who Vinny knows.
Oh yeah.
Dr. Irvin Yalom was an existential therapist. Is still He's still alive. That just profoundly just influenced me. But he wrote a book called Every Day Gets a Little Bit Closer. And there was a woman who couldn't afford sessions with him. So he just said, if you agree to write just a page or two of what this particular session meant to you, I will do the same. We're not going to read it. We'll put it away for as long as it takes for you and I to do therapy for a year or two. And then with your permission, if I can then take that, his wife was an editor and a writer. If there's something there that could come from a book, then, that would be payment, and she said, fine, we do this. And it's a great book. But the interesting thing was what you brought up just now, Greg, was that when he looked, what he thought were the points where it was transformative absolutely had nothing to do with it. Where the therapy changed was when he was more vulnerable, when he talked about his struggles, when he talked about the way he dealt with family issues himself or what scared him. And that was that bonding moment that then allowed her to feel better. So, it really is interesting because you think like, oh, I'm going to make this great interpretation. It's right here in front of me, and it could just fall dead. And then a person comes in, later and just says, I remember when you said that, and you're sitting there, so when did I say that? you know, so we always have to
100%.
just be. That's why I think we have to be just really careful of, being humble, respecting the relationship, and realizing that we're all fellow travelers here. And the same thing that affects an individual who comes to see me is the same thing that will affect me because these are these existential concerns of life.
Oh, yes, that's so good.
Yeah. Yeah,
So true, in that so much of the magic comes from two humans coming together vulnerably in the same
absolutely.
space. So, this other emotion that I want to ask about, anger, one I've
Yeah.
been grappling with, not because I'm an angry person, but because I'm on the other end of the spectrum. It's hard for me to get angry. I think because I push a lot of stuff down. But how does one make sense of anger? I am working on how I feel about it. But for a while there, I thought that anger was just a useless emotion. And I know that that's probably not the best way to think about it either. So,
Yeah.
what do you think
No,
about
it's
anger?
yeah, it's an incredibly powerful emotion. We can feel it very quickly, so you could see the advantage of it, right? If you need to get revved up to face a threat, so we can understand where this emotion evolved down and was highly adaptive to be passed down to us. But I go back to the Stoics. I'm a big fan of the Stoics. I try to read them every day. And, there's this, you know, uh, it's a quote that's been falsely, I think, ascribed to Viktor Frankl, but there's, between the stimulus and response, there's this space, and in that space is your freedom, and in that freedom is to decide what you do, right? So, going back 2,000 years before, it's just we have an ability, no matter how quickly that anger or any emotion comes, to take a space. And that is our responsibility. Not to blame someone, right? Because there are things that happen that very difficult to people in terms of trauma and abuse and things like that that will have these things come out. So I don't mean to dismiss that, like it's easy to just take a step back. But ultimately, we do have the ability to take that moment or learn how to take that moment between something getting us and then reacting with anger. And in that, I think we learn about ourselves. What is it? I mean, I've learned about that. What are these vulnerabilities within me, these insecurities, and doing my best, especially within the context of my relationship with my wife early on versus now that we're in year 16, and understanding some of these patterns in my childhood and how those came about and how I was just almost ignorant to them. And here I'm the psychiatrist, right? And I'm still falling, a victim to them. And then there's the other end of the spectrum that you can kind of relate to. It's like I don't get really angry. I don't really get in tune with that emotion. And there are some personality types that are like that, but it also requires that same type of taking inventory to understand, is this a healthy a way that I'm dealing with these emotions and that I'm recognizing them, I'm analyzing them and trying to be a steady? Or is it because of something that I've gone through that now, in some negative way or pathological way, I'm pushing down any kind of emotion? And that can be as bad as overreacting as well. I'm not suggesting that's you, but that's how we have to look at it on both ends of the spectrum and understand, because anger is an appropriate emotion, and doesn't mean that just because someone gets angry that there's absolutely something wrong with them. Far from it.
I guess it's very situation dependent. It would be very appropriate for certain situations, less appropriate for others. And speaking of the Stoics, Vinny and I also love Stoicism. And I think it was Seneca. Again, I'm here I go, probably misattributing, but talking about the first movement and the second movement of emotions. So the first movement is that instinctual, something happens, someone steps on your foot, you start to get angry. And then the second movement is where you can catch it. You can realize, oh, that was an accident. They didn't mean it. And like you said, you have that space in between stimulus and response where you can choose how you want to show up. You don't have to show up as angry and yelling. And he was a big fan of this because he said if you fully let go and let loose into your anger, you become like the rock that smashes everything on its way down.
Yeah. It's very true, right? So it's just a matter of how do I do this? I'm looking over right here at my monitor and I have on a big post-it in the center of it on the top, learn to be indifferent to what makes no difference. That's Aurelius, right? So in
Hmm.
terms of that, not just the stuff of the day, but also our emotions, in terms of when they're coming in. First off, it is a mandate for me to sit there for a moment and understand where it's coming from. Is this attributed to someone else? Or is this ultimately attributed to me? And if it is it insecurity? Is it vulnerability? Is it a deficit within me? And am I doing my best to correct that and make amends and get stronger about it? So,
Hmm. Well, this might be a good time to dive in on all the emotion stuff and how it relates to chronic pain,
sure.
because Greg, it's interesting that you say you like push down your anger, and I think I'm kind of the same way. That I people have asked me like, "Are you happy all the time?" And well, if you only knew that, I've been in pain all the time for the last 6 years in my 20s, and I've kind of grappled with this thing of should I, yeah, should I be angry or should I be,
Yep.
because it's almost felt like I've overcompensated with the pain from with trying to be kind of just happy, and I have writing and that's like giving me so much meaning. But I mean, and open up the can of worms here with TMS and chronic pain and um how repressing emotions actually leads into chronic pain. But before we dive into that, can you just explain kind of just how you two uh, came to know each other? Because I think that story and how it leads to me is just quite surreal. And then we'll go from there.
Oh, I think it was just on LinkedIn, right, Greg? I mean, I think we had checked each other out and then just had sent some likes, sent some comments. And you were kind enough, I think, to reach out to me after I had posted on a couple of your posts, which were fantastic, continue to be fantastic. And I think we just kind of built a little bit of a communication and talked about maybe doing this. And then, Greg mentions, oh, my friend Vinny's been, suffering with chronic pain. I'm like, you got to be kidding me. And it's kind of this, based on TMS or Dr. Sarno, that tension myositis syndrome.
Hmm.
It was amazing that there was that connection there.
Hmm.
That's exactly it.
Yeah.
And I think it's just more evidence that the universe is out there conspiring,
Yeah.
because the more I lean into following my passions, my interests. You left a super thoughtful comment about guilt on one of my posts, and I was like, oh my gosh, I need to learn more from this man. And then we had that conversation, and then of course Vinny's back pain. So take us away
Yeah.
in whatever direction
Yeah.
we need to go.
Yeah.
Yeah, so then yeah, Greg told me that story, and then I was just starting this new journey of, so for 6 years I dealt with chronic back pain, and like most people do, I thought it was physical. I thought it was physically something wrong with my body. I had an injury when I was 21, something just working out, lifting weights, and it just lingered from then on. It never went away, and it's been the greatest challenge of my life. And then I got to a point where just these crazy kind of serendipitous events started popping up, and it led me to realize that, wow, this is actually not physical. This is it's called TMS, and we'll get into it, what it actually is, but this is actually an emotional thing. It comes from the brain creating pain in the body. And then Greg told me that, yeah, you reached out and you guys were talking, and that you were um, dealt with your own chronic pain, and you knew the work of Dr. John Sarno and everything. I sent you a long letter, and you told me that. Well, I'll let you tell the story of how you kind of came into the world of TMS.
Yeah, it was back in 99, 2000, very similar story, exercise, and I tweaked something in my back, and it just never got better, and it was not getting better. And Eventually that's kind of what led to that first episode of depression. But at that point, I mean, I was going to so many specialists. And, you're fortunate when you're a doctor because you could kind of get in fairly quickly, or people will pay attention to you a little bit more, other doctors. So, I was getting in and, probably being able to be seen and treated much more quickly than anyone else, would. So I was fortunate of that. So had injections done on my back. We had gone to see probably one of the best interventional guys that injects the disc to see where the disc is torn, because I was convinced it was one of the discs. That's what the MRI had said. And I remember this guy. I'm looking at this, at this film because he's like, "Come on in, I'll go through this with you." My dad's a radiologist, so he's there too. And he's like, "There's nothing here. There's nothing here." And I'm like, "Look right there." And he goes, "No, that's just an artifact from this disc to the next one. It's the space." I go, "No, that's a tear." He literally grabs me and he's like, "Peter, I've been doing this for 35 years. That is not a tear. Your discs are fine." So I'm like, God. So now what, right? And it was just pure serendipity. I'm sitting at home one night, and I look over, at that point in my condo, one of the rooms was converted to a library. And I look over and there's the book, Healing Back Pain. I honestly don't remember ever buying it. It was just there, Healing Back Pain, Sarno. So, I mean, I'm a book geek, so I would, just go to half price books and stuff and buy stuff if I thought it was interesting. So I probably bought it like that. So at this point, I'm almost a year into it. And I start reading this. And yeah, I started reading it and I thought I felt something different, just in my back. Not anything huge, but I just felt a little bit of loosening. So I'm like, what the heck is this? So I start reading this. I got a couple more of his books, Mind Body Connection. And so Sarno was, for those that don't know, John Sarno was a physician in New York who really brought attention to this idea of mind body pain. Tension myositis syndrome is what he called it. And the basis between this was in response to emotions, particularly conflicting emotions or repressed emotions, the body will create physical pain. It's real pain, but the point of it is functional and it is survival based pain. It's not neurotic or hypochondriacal pain. The point is, in response to these deeper emotions that might cause extreme pain from coming out, the body will deflect because it assesses the physical pain is less painful than unearthing some of this emotion. And I think for anyone who's been through both physical and emotional pain, I think, I've had people throughout the years tell me there's nothing worse than depression. It outdoes physical pain exponentially, right? So you can see where moving that physical pain to protect against the emotional, can be adapted by the body. So being a psychiatrist, it spoke to me. So I started reading more, and there was another physician, David Schechter, who was out in California, and I said, I got to meet Sarno. So I initially had gone down to meet him in New York, on the Lower East Side, where he had his clinic as a patient. And he's like, you absolutely have TMS. That's all this is. He goes, I've seen thousands of this, and you're classic, obsessive, perfectionist, hard driving, just this, perfectionist kind of personality. So I'm like, okay, well, he gave me the blessings, and he gave me some more information on what to do. And that was the beginning of my recovery. It was just starting and then continuing down that road, and it ultimately changed the course of my professional career because about a half a year later, I asked John if I could come and spend some time with him in the clinic just to learn. So I'd spent some time with him at Rusk. This was in 2000, maybe 2001. I can't remember the time period, but it was great. Got to see how he did his evening sessions where he had his patients and did the group sessions, and it just transformed also my psych practice, where I started to look at this as well, in possibly treating some of these individuals, and continue to do that to this day. There's been a new generation. Dr. Sarno has passed since, but it's incredible. There was a group of us back in 2009 that wanted to take this the next step further. Psychophysiologic Disorders Association, run by a fantastic clinician, David Clark, out of Colorado, and others, Dr. Howard Schubiner and others, we started this Psychophysiologic Disorders Association. There was about 20 of us, 30 of us in 2009, and we had our first live one since the pandemic this past year in Boulder, and there were 260 clinicians who had come to it. So of all different disciplines, this is the beauty of it. It's not physicians. There's physicians, but there's psychologists, there's social workers, there's coaches, there's massage therapists, dancing, therapeutic dance, and all of this, trying to understand where this all came from. But the basic part of this is understanding that in the same way that if I embarrass you, your face is going to go red. There's an emotional reaction instantly. Or if you get nervous, something happens to your stomach, your heart automatically starts to go fast. We understand that emotions can impact. So both the conscious, but also those that are unconscious, and there are protective mechanisms that the body puts in place to protect. So, it's, you know, I've seen it with many individuals. Everyone comes in and says, when is this ever going to go away? And, how long does it take? Is the first thing they say. And, it's just a process, I think, of getting to the point. It's almost like a cognitive behavioral thing where one gets to the point that they understand at some point there is no other explanation but this. For me, it was a period. If I can go into this, I don't mean to bore you with the story,
No,
but
please, I've been waiting for this.
yeah. So it was towards the tail end of all this, and the last thing that would get me is shoveling, like shoveling snow, or trying to bend down and scoop something. And I had to get to the hospital because I was doing consult service during my residency, and there was a snowstorm, and I'm like, how the hell am I going to go? There was about a 15-foot sidewalk that I had to shovel to get to my carport. Like, I'm paralyzed. I'm like, oh my God, is this gonna, and something came over me. It was overwhelming anger. I don't know that I felt that kind of anger in my life many times, but I was just like, no, there is no effing way. I'm going out there. You're not taking over anymore. I'm shoveling the snow. I'm going to work. So, and I remember I was just like, oh, I don't care. I don't care. It's not going to happen. Get in the car, drive down, park, get into the consult service, no pain. Consult, you're walking around all day, right? You're going to the hospital, you're not in the wards. Walked around all day, nothing. I go home, I relax, I'm waiting, I'm bracing for this to come on. It didn't happen. And it was really that point there where I had just said there, that, it was just this intense belief that then took over, that finally wiped away all of the, all of the doubt. And I still will get pain from time to time. It's not like it just completely went away, but it's gotten to the point now where I can focus on it. I can go back to some of my readings, some of my meditations, and for the most part, it goes away quickly. So, I can recall certain times where I'll be laying down. It's like this incredible sciatica comes out of nowhere, right? And it's like I can't even lay down. My butt cheek hurts so much. And it's just slow down, take a breath, and over time, just it dissolves away. This is your mind. This is not your body. There's a few things that I've kind of incorporated in my meditations, kind of this younger self who was very vulnerable, and now this is my older self who has learned and comes, my meditation is just, I picture this younger child almost scared and crouching in like a dark room, and kind of older me, if you will, or someone, father figure, something, just comes over with a blanket, holds, everything's going to be okay. And that meditation for me has been how I have just been able to calm and allow for the pain, to go. It's not certainly for everyone,
Mm,
right? But there are these series, particularly with the work that Howard Schubiner, Dr. Schubiner is doing, where these protocols have been tested in research against traditional methods of treating, let's say, fibromyalgia, and have been found to be superior to them. And the data now is, this is the next level of where psychophysiologic disorders is going, is research. What can we do?
mm,
What can we prove actually works in this functional pain syndrome, rather than just saying, here's what you've got to do, expressive writing, and will this help you or not? So these very focused types of therapies that are now being tested to say, would we pick this over this? And this is how we can expect someone to respond. So it's an exciting time. And over the next few years, I think there's going to be this blooming of research that comes out in this specific field.
mm. So cool. And I was actually, I mean, I follow this guy, Dr. Jim Prusak, on YouTube. It's called The Pain PT. Kind of came to his channel serendipitously. Just found he made a video, just kind of talking about Dr. John Sarno's 10 steps or daily reminders.
Yep.
And I was watching Dr. Clark on his podcast recently, or just on his YouTube channel, talking about that conference. So I am becoming kind of just part of this world, and kind of what relates to what you were saying earlier about just, or what I asked about earlier, these difficulties in life changing our lives and actually sending us on kind of the path of finding deeper meaning in life and finding just a richness that comes from overcoming these difficulties. And like me, I mean, I 1000% know that this has changed my life beyond anything else. And dealing with this, for 6 years, when I didn't have the answers, when I didn't know about TMS, and that this was coming from childhood adversity and then my personality types. And maybe in a second, we could just break down like what actually feeds into TMS and what creates it in the first place. But yeah, it's cool to me that these extremely difficult things like sent you on the path of your practice and discovering like what you're truly on this earth to do, in a sense. And I feel like it's happening for me here in real time, and I'm still on the path. I'm still healing my chronic pain. But yeah, it's been just one thing has led to the next of just finding you in the first place. And that was kind of the first star in this constellation of my healing. And then just reading all of Dr. Sarno's books and finding this guy, Jim Prusak, who I've had several sessions with. He's in San Diego. And just, I feel like I am understanding this stuff at the same time as the whole field is kind of budding and it's going to blow up. And that kind of leads into my next question of why isn't the medical system more kind of welcoming of this information, and like, why isn't it more well known that these things are mind body symptoms? And yeah.
Yeah, it's a great question. I mean, I always joke with people, you don't go into psychiatry if you're looking for, a ton of respect by either other doctors or, patients, right? Because there's so much stigma. To be fair, a lot of the stigma that comes from that is inflicted, right? If we look
Hmm.
at the history of psychiatry and some of the things that were done back in the day, um, and especially this reliance on kind of this holy grail of psychoanalytic theory and Freudian therapy to the exclusion of others, right? This dogmatizing of this type, almost to a religious fervor in the 50s and 60s and 70s. And now I think we've gone too far the other way with, the holy trinity of dopamine, norepinephrine, and serotonin, right? These neurochemicals, and that we're trying to explain it in that way. And I think the answers are somewhere, in the middle. I think it's really, really hard. We don't get a whole lot of training in medical school. These aren't easy things to talk about. And if you're not trained in this and you've got your own vulnerabilities and your own motivations as a clinician, right? It could be very hard, to deal with this. Um, in a generation before, we didn't have the treatments, certainly on the biological end, like we have now. So there is more of an understanding of it. I think, being able to the explosion of the internet and social media, for all its ills, also allows for awareness and the ease of people talking about emotional illness. But particularly as it relates to the emotions and chronic pain, and again, I'm not coming down on a specialty of medicine, but when you have procedures and treatments that are incentivized financially, right, then it naturally will move in that way, right? If I know that I can do a certain amount of procedures, and I meet, say, a quota or whatever it is, then I will likely do those. I'm not suggesting in any way that people are doing anything that is unethical, right?
Mm.
But the hand moves in kind of in that way, right? And I kind of feel it myself when it relates to that. I see somebody and like thoughtfully, like, do I need to see them in a month? Do I need to see them in 6 weeks? Do I need to see them in 8 weeks? What's right? Because also my reimbursement matters, right? If I see them in a month, that's only 4 weeks, but I see them in 8 weeks, there's one less visit, right? So how do you do that? And I'm trying to do it as ethically as I possibly can, and I think others are in other fields, right? But when the focus is more on the physical, um, it goes through these waves, right? I have a friend of mine who's works for the state for disability, and this sea change that has happened with back in the 80s and 90s. He barely even had to do a whisper to get a back surgery approved through disability, right? A fusion or a laminectomy or a discectomy or anything. Nothing. Everything got approved. To now where it just is a whole sea change where you've really got to prove it, right?
Mm.
So I think part of this goes, through waves, and weaved within that is maybe more of an acceptance of psychiatry and mental health, to where we're at this moment where, we can see that we go through these waves of what we think is physical, but maybe has never shown to be correct. Or how do we reconcile the fact that there are thousands of people that have been studied now in these studies who have no pain, and the vast majority of these individuals will have diagnosable imaging. There'll
Mm.
be something wrong with their disc. There'll be something wrong with their shoulder. They've got a rotator cuff tear or a labral tear in their hip, or they've got disc degeneration, literally vertebral bodies pushing into the spinal canal. These people have no pain. No pain. So how does that settle then when I see someone who's got some problem on their MRI? How do I know it's causing that? Right? I believe that it can cause it, but also I think we have to realize, is everything that we see causing pain physically? It just doesn't square up. How can we have all these people with all these abnormalities that are completely pain-free? Yet a person will come to see me, I look at their MRI and it's completely clean. They're writhing in pain. So there's also this complexity that we really don't understand pain a whole lot, period. But,
Mm.
I think this awareness, I think of things, mental health, that probably come generationally, and this more skepticism, let's say, of what we thought was the old way of treating that kind of coalesces real nicely now to where psychophysiologic issues maybe have a foothold and can maybe enter that conversation a little bit more easily. That's kind of
Mhm.
how I see it.
Yeah, I think just we're so it's easier to to go to a doctor and it's easier to prescribe a pill or to say this is what's going on. Like I see it on the MRI, it's just like a bulging disc, and this must be what's causing the pain. To then ask, or instead of asking like what's actually going on in your life, like asking
Yeah.
deeper questions of how you actually feeling. That's not something you get in like 20 minutes at the doctor's office. It's just the system of treating things physically and just having it be a, I'm feeling something physically in my body, this must be a physical symptom. And just as context for everybody, like it is, so basically we treat chronic pain for the most part with, like I tried, and anybody who's been in chronic back pain or anything like this has tried the full spectrum of treatments, like all the physical therapy, and then you get to acupuncture and everything. And when nothing works after years of trying all these different things, that's when it's almost out of desperation that people might find one of Dr. Sarner's books and be like, wow, maybe this actually is something deeper going on. Like I know with me, my mom would say, like, are you sure this isn't emotional? Like, is there something? I'm like, how can it be emotional if I'm feeling back pain in my body?
Yeah.
Like it just
Yeah.
doesn't, and that's the common sense, which is not very common. It's making us think that, it has to be something physical in the body, but it's amazing that what I've learned through just these books and learning about TMS is that it's actually the brain is the captain of the ship, and it can create anything it wants in the body, and it uses this pain as a distraction from things that are actually going on inside. And it might take trying all the physical solutions that you think might work, the injections and hopefully not surgery or anything, but to make you think, wow, maybe there is something. Like I got to the point where I was like, there's nothing out there that can fix what I'm feeling. It has to be coming from inside. There has to be some sort of disharmony or something that I've just not been able to understand that's coming from within. And the coolest thing about like TMS and about healing this stuff is that it's not like you need to get, you have not only get to solve all of your problems from childhood and you have to change your personality and stuff. You really just have to understand what's happening, that it is the brain creating the symptoms in the body. And maybe could you just talk about that a little bit, how you do actually start healing from chronic pain from TMS?
Yeah. It's I'm a very below average guitarist, and despite all the years I've been playing, I am still very below average guitarist. But one of the fun things is, for anyone who plays a musical instrument or even a sport, right? It's just how do I go from this practice, 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 and I'm very, very frustrated because I'm trying to play this chord progression and I can't get it. And I'm playing it, and all of a sudden it starts to get a little bit better, but I'm still messing up. I still can't get my fingers to do it. And you come down one day, no different from the last day, which wasn't the ability to play it. And all of a sudden, magically, it all comes together. And you play it. It's like, what the heck happened? Last night I couldn't do this. All of a sudden I've done it tonight, right? So, I think I've learned a lot from that experience, and that, you know, you take, you must do the work and reflect, read, meditate, understand that this is part of the brain, and that your body is trying to protect you, and that you are okay. You will be okay. And it doesn't mean just because you have that awareness, boom, it happens. But over
Mhm.
time, hopefully, what people notice is, and I think this is how it gets better, certainly was for me, and what others have shared with me in terms of their improvement, is you start to feel a bit better. And that little bit better provides hope, right? It starts challenging the thought that this is a busted disc, right? How could I get better if all I did was meditate on this and the next day is a bit better, right? And then that confidence builds and it builds and it builds to where I think, like it did for me at the end, was just like I had enough proof of all of this that it was fine except for this one area, and that was it, no more. It was going to be done then. But it really doesn't, it betrays all the work that I had done in the months and years before to get to that point, right? So for many people, they can do it very, very quickly. For me, it took time. But I think that it is doable. And I think that it is, almost like how we do in therapy for emotional issues. We have to unlearn these patterns. They're there for a reason. They protect us, and they're ingrained because they're survival based, but they don't necessarily help us because it's pain. But we can unlearn these patterns. And first, we have to get back to them, understand that these patterns can be learned in a negative way, and that's what leads to our pain. But we can go at it and thoughtfully, with compassion and grace for ourselves, start rewiring our thought patterns in our brain to where it can loosen up. It doesn't have to do that anymore because the things that we feared are out there in the open. And for me, just therapy in general, I think that is the essence of it. I don't think it's this great interpretation by the therapist. I think what happens is those issues that are so terrifying, that are so scary, are allowed to be released, and you realize it's vapor. It's there's no wall there. It was all vapor, and you're able to kind of push through it. But to get to that point is terrifying because you're looking at that and it's a brick wall. I cannot put my head through that. That's crazy, right? But then when we do it and we get to that point, whether it's TMS or the emotions, just depression, anxiety, or unresolved issues, I really think that it's that is the transformative part where people start to feel better. That which they were terrified of and scared of turns into dust, and it no longer holds that grip. It can still come back because it's still a pattern that we learned, but as if we can prove that to ourselves, I think that's where the transformation occurs.
Oh, that is so good. And I want to hop in with a couple of thoughts. One with the unlearning that you mentioned. I think that's so important here because pretty much everything we learn growing up about pain is okay. If you're in pain, like take it easy, relax, like don't do any of it. And I remember when Vinny came to me at first and he was like, I have this thing, it's TMS. I need to just keep working out despite the pain. I'm like, okay. And like knowing Vinny, he definitely has a history of just going so hard in the gym, man. He destroyed me in some workouts back in college. And so hearing that you need to essentially
Cost us some again.
unlearn that the pain is bad and that you can get through it, like you said with the shoveling snow. Like you had to do that one thing that you were afraid of to break through it. And then I also think there's a deeper unlearning here that's kind of insidious if you think about it, because you mentioned that this type of TMS pain is experienced by a lot of people who are perfectionists. They're probably type A, they're driven, they're hard charging, and it's almost unlearning that piece to heal it, that
Yeah.
you can't just like clench your way through it. You have to slow down, meditate, do these things and really let it emerge as it's going to.
Yeah.
Mhm.
Well, and some of those patterns, right, the perfectionistic patterns aren't necessarily healthy, right? They might serve some purpose that allows you to be productive to a certain point, but people break down, right? So being able to analyze that and to say, what is it that's making me do this? Like, why am I driving this hard? Not that you shouldn't be motivated and try to do your very best, but to the point where it does not allow you to relax or becomes destructive, then what is it that is leading me to that type of feeling? Why must I go there? And a lot of times we find out it's deeper issues of insecurities or vulnerabilities that we have to reconcile.
Feeling
We're
like
almost
you've
projecting it.
Yeah, just feeling like you've only done enough or are enough once you've absolutely ground yourself into the ground and there's
Yes.
no more work that you could do because you're so physically exhausted.
Yeah. And I'm sure you see that. I'm sure you see that a lot in your coaching, Greg. I mean, that's got to be part and parcel of individuals who come in to see you and kind of need guidance.
It 100% is. And then you have so many people on the internet yelling, you just need to work harder. You just need to do more. You need to hustle. So it's this, yeah, really difficult dance to figure out what is what you truly need and not what other people think you need.
Yeah.
Mm.
Um,
Yeah, it's like, I mean, the whole concept, like what I'm just in the season of healing, pretty much the crux of TMS healing is just learning how to relax the nervous system. And that is what I'm healing rather than the body. It is, I'm learning how to well, I'm unlearning all this conditioning over over my entire life of kind of suppressing emotions, being quiet, not speaking up, and maybe not showing anger when I felt it as a kid. And I realized that I did have TMS symptoms when I was a kid, like even just headaches and stomach pain, and it just really, come to a crescendo in my 20s in back pain. But, and that's just something else worth noting, is that it's not just back pain, it is anything really physically that can't really be explained. Like you said, fibromyalgia before, which is pain throughout the body that's pretty unexplainable. Um, Headaches, back pain, obviously, knee pain. Like it's limitless what the brain can do. And this whole process of healing is really learning how to like respond instead of react in those moments, um, to situations that we can't control, and just really learning how to let go of all these things, the hustling, the doing, and just learning how to kind of look within ourselves and just really just be. And I think that is the coolest thing that I'm discovering here, is that it is, there's nothing that I have to fix. There's nothing that I like have to heal. All I really have to do here is let go of the need to fix and to heal and to figure this thing out. And just knowing that you will be okay, that things aren't, that you aren't broken. That has been the greatest just relief and weight off my shoulders, because the fear and the worry, that is more debilitating than the actual pain. In my experience, the fear of back pain, the fear that I was going to have another flare up, the fear that I am doing something wrong or that I'm never going to get better, that is what actually perpetuates the pain and what makes it worse. And that's when it becomes just a vicious cycle.
Yes.
And there's so much to kind of cover, but then it's also quite simple in a way, where it's really learning that you aren't broken. There's nothing physically wrong if you have had the MRIs and stuff, and it says you just, like at 30 years old, I think 50% of 30-year-olds have bulging discs and herniated discs without any pain. So it is a natural thing, but we associate what we see in the MRI with the pain. But there is, yeah, it's this whole world that I think is just really starting to open up, of, you know, understanding that there's a world inside of us that needs to be explored, instead of just trying to fix things with, exterior, band-aids. It's really, the healing is within us.
Yeah. And it's harder in today's culture because there's a million ways that we can just kind of distract away, right? And not necessarily dive in, no matter what it is, whether it's, this type of pain or, things that we fear about pursuing, further and advancing ourselves. And it's terrifying. And, oh, I can just go over here and not think about it, right? But our, it catches up with us. It catches up with us in the form of insomnia. It catches up with us in the form of anxiety that comes out of nowhere. So if we can understand that, yes, I can see how that can happen if I'm just kind of not doing what I should be doing and not fulfilling myself, and here squirts out some panic or anxiety, isn't it possible that part of that manifestation can also be of a physical nature, right? And we have
Mm,
to be a little bit careful, at least in our field, that, we're not being just absolutely dogmatic that every pain is TMS or psychophysiologic, right? Because, I'll
right.
have this discussion, with the folks in our group and say, okay, we can understand that if a disc is pressing on a nerve, that doesn't necessarily mean that that's where the pain is coming from, right? Yes. But if it's pressing on the nerve and you can't lift your legs, is that TMS? And it's like probably not. There's probably paralysis there because you've compromised the nerve. So I think it's important to also just in talking about this and talking about it emphatically, it is in no means meant to be dogmatic, right? That it's all of chronic pain can be expressed in this way, but that maybe what we need to do is allow for the emotional aspect of what it means to suffer to enter the conversation sooner than later, right? Not as a default
Mm,
garbage can after I've done everything, but how do we move that a little bit forward that is in a typical kind of analysis, whether it's in the medical profession or at least by individuals who are suffering, to say, can I look at this because there's enough now talked about with regards to physical pain and emotion, so
Hmm.
it's still early in the field,
Hmm.
you know. But
How do you think?
with
Go ahead.
go ahead, please. No, please.
Uh, I was just gonna say, how do you think childhood experiences feed into? It's a big question, but into chronic pain.
Well, I think they fit into all of our emotions, right? We're an amalgam of everything that has happened to us, right? I can't stand when my name is yelled. I can't stand it. It just drives me berserk. It's a reaction that is off the scale in terms of what I feel emotionally. And I'm, like, why? Well, it was because when I was younger, I'd be playing down the street with my friends, and my mom, who was this neurotic Greek woman, this immigrant, would open up the window and scream my name because she thought I was going to be kidnapped or killed, right? So she'd be
Hmm.
screaming, Peter, Peter, and I'd have all my friends making fun of me, right? So, it makes sense that if I, later on in my life, if I hear that, it immediately I get the emotion, but I'm not necessarily associating that with my mom. You got to take a step back. 30 years before that, when they moved here, my grandfather was a jeweler, and they were, home invaded and bound and gagged at gunpoint. So she did a lot of that because of the trauma she went through, not just because she was just neurotic, right? So how do I kind of do some of this work to understand, yeah, even though I can be upset at her, there's also a story behind that as well, and can I give myself a little bit of a break? So, that's just me in one thing, but all of us go through these experiences that affect us, right? And it most of us will adapt just fine, right? It doesn't necessarily need to be traumatic. It doesn't necessarily, I mean, we can go through very, very bad things, and many people have. And it's like, how do we understand, how do some people go through these terrible atrocities and traumas and abuse and are fine, let us say, right? They're not so impacted by it, and others are, right? So there's a whole, you know, in between there, but that these emotions can affect us, of course, because we exist. We exist and we experience all of this. We adapt to those things in our formative years, and they become survival habits later. For most of us, they're very adaptive and they don't come down to impact us to a large degree, but they can, and they can impact
Hmm.
us. So, I fully believe that it's those childhood experiences to some degree. I mean, for me, and TMS, it comes more from the existential perspective, these anxieties of our lives, our mortality, our isolation, our meaning in this world, and our freedoms that we have or don't have, that are part of the human experience, that when we try to wrestle with these, it can be very, very painful. And one way that we can deal with it is to distract away, both with behaviors that we do, whether it's drinking or social media or highly productive or hyper productive. And for some, it comes out physically as well. So I don't know that John had it completely right with just anger,
Hmm.
but I think the point that was so important back then was that emotions were linked to the physical.
Mm. I was going to ask about that next because you sent me in your email that you do think, like you studied just the mortality, the existential isolation, meaning, and freedom are such an important part of this as well. And it makes a lot of sense to me how, I mean, for one, the pain started when I was 21, and that was when I just graduated college. I was trying to figure out what I meant to do in the world. I kind of got into a field that became a real estate agent, which I was working with my best friend, but I had no interest in real estate.
Yeah.
And I knew that I wanted to get into writing and do just kind of follow my heart and travel and stuff. But I was kind of doing what was like more realistic and what I had an actual step to take. Whereas with writing, I didn't really know what to do besides just start writing. But like the field was so open. And then I had the trigger incident, which was working out, but then with chronic pain, it often, if it is, TMS and brain induced, it is the brain using an actual experience just as a trigger. And then that's kind of what makes us believe that that injury is what causes the pain. So of course I thought that that's what caused the pain for years. But if we look back at when our pain started, it is often at a very stressful time in our lives. And I was definitely trying to find my place in the world, trying to find what I meant to do with my life at that time. And um, I think that's, yeah, a very stressful time for people. And after graduating college, and especially for our generation now, and maybe just kind of touch on like how maybe what you've seen or what you can just advise for finding meaning in a quite a confusing world right now, and um, some practices maybe you use, or just your thoughts on that.
Yeah. I mean, it is, it's, I think, there's not enough credit given, to your generation, for, you've all basked in this your entire lives. And I think for the most part, you all have adapted incredibly well, to it. There's a lot of us, just yelling at clouds, because of all the changes that have occurred, right? And social media is the end of it all, and da 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 da, and it's destroying people's lives. But, you're also living in all of that noise and carving out solid lives and figuring it out despite that noise we didn't have. So in that, you have to deal with that, and you are dealing with it, right? So I think it's really important to recognize the strengths that you possess, that are real, that are happening, right? Even for you, Vinny, in terms of the struggle that you've had with pain, the irony is coexisting at the same time with everything you're achieving, right? So the strength that is implied there, take the pain away, how much easier, let's say, it would have been. So there is that gap in that area that is so much strength, that as this goes away is all for you to then, continue to move you through life, and it will. And this is what I see with individuals, both in the younger generations and also those that I treat with pain. It's like you're carving out your lives despite how hard this is. Who is the stronger one right now? And how can you allow for that to be part of your reality? Because it's happening. It's unequivocal. You are unbelievably strong with everything that you're balancing. How do you allow that into your life to realize it and not see it as just this deficit? Because I'm hurting, this means I'm weak, right? It's an unbelievable irony, if you really think
Mm-hmm.
about it, so trying to bring that into awareness, and I don't know, I try to meet people at their level, and try not to focus too much on method, right? Let's talk about what it is. Let me share maybe some of what my struggle has been, maybe things that have helped me, not in an inappropriate way, because it's not really about me, but insofar as the importance is the relationship together,
Mm.
that is more profound than the actual method.
Mm. Yeah, that's amazing. And I appreciate you saying that so much. Thank you. And
No, of course.
that's that's why
But
it's
that's
this. It is
absolutely
this.
true. That's absolutely
Mhm,
true. I mean, how can you argue that point? I'm not just saying that to make you feel better. It's just like,
mhm,
isn't that actually what is happening?
mhm.
Yes.
Yeah, it is this crazy irony of, obviously I didn't ask for this, and then there's of course moments in my life and where I was like, why me? Why did this happen to me? But then at a certain point, I was like, okay, this does not happen to me. This is happening for me, and I don't know why right now. I don't know how I'm gonna get out of it, but it is making me a writer. Going through this and having this experience and getting to a new depth of just relating to people and why we're alive, and it is it is truly, it's blows my mind to try to conceptualize how this thing has affected my life and how it has given me so much meaning and purpose. And maybe that's just a great place to kind of wrap this all up is, like you were saying before, like post traumatic growth. Heard about that in Dr. Stephen Ray Osnich's book, The Great Pain Deception, which he mentions you
Yes.
in.
Great
And I
book.
hadn't talked to you yet. I saw your name in there. I was like, wait, what? Just all these crazy stars aligning again. And he talks about post traumatic growth. And I just know 100% that is the case, that it is so possible to go through these insane, I mean, just think about all the things people are going through now across the world, and just that people have endured for all of time, and just how we as human beings have persevered despite the things we go through. And it's one thing to say, like, yes, you will get better when, so like you will, you know, this will make you a stronger person and stuff in the end. But what can you advise maybe just when somebody's in the throes of it, when they don't, have hope and don't see a way out of the darkness and out of the tunnel? Like how do you survive and just endure while you're in it?
Yeah, it's a really good question. I guess the most important thing is you're not alone. Uh, you may feel terribly alone, whether it is the physical pain or the emotional pain, but you are not alone. There have been others that have been in that boat and have come through. Nothing, no pain lasts forever, whether it is physical or emotional. There is improvement that will occur. There are people that love you, that care for you, and I think that that's just the most important part beyond the method and what you should be thinking or not thinking, despite how alone you feel. And I think that that kind of got me through even the biggest depths, was just to just kind of reframe. And even though I could just understand it as a statement of fact, not necessarily emotional belief, it did provide me some solace. And, this is what I try to, impart on my patients every single day. It's just take it this day, but you will not always be like this. Or people have been through it and realize they go through these depths, but they've also had the benefit of feeling better and they know, right? So tapping into that as well. You can recognize when life has been better, you will get there again. And those are just, I think, the core things to really take heart if you're doing it just on an individual basis.
Hmm. So good. Greg, anything else, buddy?
I had one question I wanted to weave in here because it feels really
Sure.
important as we've talked a lot about being in the midst of the pain, and the chronic pain and the depression. Once you come out the other side, and for you, Peter, as you healed yourself of that back pain, how do you not become dogmatic about the approach, about what worked? You mentioned that word earlier, and it really stuck out to me because it can be so easy to say, this worked for me, it's going to work for you, it's going to work for everyone. How do you guard yourself against that?
Yeah, I'd let people know this is my story. It's gone through a process of my own personal healing, but also my own personal exploration. I don't necessarily, there is a set of symptoms and makeups that suggest this, that may predispose a person to this type of pain, but also different types of interventions that can help, right? But, I tell people, you don't just believe me, because there is the vulnerability that I've gone through this, so I'm kind of the religious preaching to the others, right? But also, I don't think that that disqualifies me completely. Let's take a look at this. Let's thoughtfully look at it. What are the findings? What have you been through? What have doctors told you? What is the reality of the circumstance? What remains? And if it is emotional, then how do we approach this? Right? And how do we get to the other side? You know?
Fantastic.
Yeah.
Well, if Vinny doesn't have any more questions, do you?
I think I think I'm good. I think we did a good job of just explaining what it is. And yeah, thank you so much for coming on the show and talking to
Oh
us.
no,
And
please.
just, it's been a pleasure. I've been looking forward to this one for a while, and just inspiring me and many others with the work that you're doing. Thank you. And yeah, I think this stuff is going to become more and more prevalent in just in healing, in just healing everything. Just even if it's not totally like you're saying, that definitely speaks to me of, oh, okay, not everything is TMS, and like getting dogmatic about it, as I'm just so ensconced in the stuff right now. Just realizing that yes, everybody is totally on their own journey and has to kind of come to these realizations themselves. But I think just having the mental side and the emotional side as a part of the discussion is going to become just more and more important. And so thank you for the work you're doing. It
No, of
is
course. No. I guess I'd say
beautiful.
one last thing too is, be careful of being dogmatic to just the physical, right? In the same way that I have to kind of guard against mine, realize that, be careful to buy your own beliefs of that it must be the physical only. And sometimes that can be the barrier, right? That needs to be broken first. But
Mhm.
no, it's been a pleasure for me. Thank you so much. This has been such a great discussion, and I love that you guys are interested in all of this, and it's been my honor to be on the show with you.
Thank you so much for being here.
Yeah.
We could go on forever. My last question for you is, where can people learn more about you if they've been listening to this and they're like, wow, I need to get in touch. I need to learn more.
Yeah, you can always check on our practice website. It's such a long URL, centralohiobehavioralmedicine.com. So you can tell that that I'm an onk or a boomer. But so that's a long one. But you can check on, I think it's Peter Zaff on LinkedIn. Certainly, if you just look on LinkedIn, I try to post there at least a few times a week on just basic things about emotions, on physical pain, and those are probably the best ways to reach out. If anyone has any questions, there's ways to contact me, and if I can guide or direct anyone, I'd be happy to do that if I could.
Perfect. We will put your info in the show notes. Thank you so much for coming on.
Right.
And thank you so much to everyone tuning in with us today. As always, we love you guys.